Hi, I'm Adrienne Pichon. I am a third-year PhD student at Columbia University in the Department of Biomedical Informatics, and I am from New Orleans, Louisiana. I started my undergraduate studies in biomedical engineering. I really liked the hands-on aspect and designing and experimenting and coding, but I found that there wasn't much human element into it. There wasn't a lot of socio-cultural context, and there wasn't a lot of the medical studies that I was really looking for. So I switched over to exercise physiology, which was a lot more anatomy and physiology. It was a lot more sports medicine and also prevention of illness, management of illness, and wellness. So I really liked that. And I was a pre-medical student, and I did some research abroad in Ghana at a maternity ward. And that really helped me to decide that I didn't really want to provide care at a patient level. I was really interested in health at the population level and what research could provide and what interventions at the public health level could provide. And so that experience really led me to seek out a master's in public health. And that's when I came to Columbia and I moved to New York, and I was studying sexuality and sexual and reproductive health at Mailman. And so those studies were really what I was looking for, to bring in that human element, that cultural element, and research at the population level. I had heard about informatics when I was studying for my MPH, but I really didn't understand how it could be applicable to me or the questions that I was interested in. But when I started working in research, first in a longitudinal study for HIV, and then doing research with smartphone apps for health, I really started to see the potential and the possibility of using data science and technology for meeting healthcare needs and providing information, especially to communities of patients who often have barriers to care. So I started looking into biomedical informatics programs, and I first came to the department and met with Dr. Lena Mamikina, and she introduced me to HCI, human-computer interactions, and I'd never heard of it. And I knew immediately that it was something that I was interested in, and that I had found my field of both informatics with data science and technology, and then also this HCI aspect, which is really important for understanding how humans interact with technology and how we can design technology that fits into workflows of people's lives and clinical settings. So in DBMI, I joined Dr. Noemi El-Haddad's lab. And I first started working with the FENDO project, which is a citizen science project around endometriosis. The app was developed with patients and was initially used to collect information about people's illness experience with endo to help fill medical gaps that exist, because it's such an understudied condition. It's such a complex condition, and there's so much that's not known. And so the app was designed and used to collect data, self-tracking data for the initial analysis was 3,000 users, but now we have over 14,000 users who use the app. And we're creating this really rich data set that is responsive to the patient experience of disease that can't necessarily be documented in the electronic health records. And so I think bringing this perspective in and generating knowledge that aligns with the experience of disease is really important. So I recently had the opportunity to participate in a hackathon with one of my peers for his dissertation. So Oliver is working on this race and ethnicity extraction from the healthcare records, which is going to help quantify and address healthcare disparities. And so being in such a collaborative environment within the lab meant that I got to learn from him and understand kind of his work, which I think will then help me strengthen my own work. My research is working with the FENDO app to extend the functionalities so that it can be used by patients and also patients together with their providers to help understand their condition and figure out what's going on with them, to help them prepare for clinical visits, and then also to facilitate clinical visits with the patients and providers to help them get on the same page to discuss what's going on with their illness and help them to engage in shared decision making and collaborate in care. And so we're working with both patients and providers to design some visualization tools that they can use to interact with data, both on a very broad scale, kind of the life trajectory of the illness, and then also on a day-by-day, week-by-week scale to help understand, hey, am I feeling better? Hey, am I feeling worse? Is this treatment working? What kind of treatments might be helpful for somebody like me? And to help them really care for their condition, and also while meeting the information needs of patients, and generating knowledge that can be used to help improve care overall for endometriosis. Self-tracking data can be really useful for patients, and giving patients access to their own data and the ability to share their data with their providers can really empower them in their care. One thing you can do is read. There's a lot of books out there. Race After Technology is a really good place to start. It's something very new and very good. There's also Twitter is a really good place to follow scholars that are range anywhere from new PhD students, postdocs, faculty whose research that you're interested in, and leaders in the field. And don't be afraid to reach out to any of these people whose work you're interested in, just to express your interest, ask questions, and even see if there's a way to work in somebody's lab, contribute to a research project. I think that's really the best way to grow. And if you don't have access to or don't have the time to work in a lab, then you can, study on your own and learn some coding skills, do some practice projects, do something fun. And when you're doing something fun, you'll be able to build the skills that can then be really useful later on. I was recently talking to my advisor, and I expressed just worries that it was going to be difficult to get into an academic career. And she said, put your self-doubt aside and be confident that the work that you're doing is important, and that you're doing a good job to continue into a research career. And so in the future, I really hope to continue my research and to broaden my research to be able to mentor others coming into the field and advance the knowledge for the scientific community.